Yes, thank you for taking my question. This is Simon Ateba with Today News Africa in Washington, D.C. With doses of Astra Zeneca vaccine drying up across the world, can you give us an update on the COVAX vaccine rollout across Africa? How many doses have been sent to Africa now? How will this vaccine freeze affect rollout in Africa? How will it affect those who have received only their first doses? Thank you.
Thank you very much, Simon, and to Dr. Bruce Elwood.
Hi, Simon. Thank you very much for the question. So as I think most people are aware, one of the priorities of the COVAX facility has been to ensure that all countries can get access to vaccine in an equitable manner. And at this point, as again, most of you be aware, the COVAX facility has, as of today, distributed just over 38.7 million doses, and we expect to get past 40 million doses later this week. 33 countries of the African Union have received doses so far from COVAX, another 5 or 6. So we should go over 40 countries on the African continent will have received doses by the end of this week. And they will receive nearly half of the doses from COVAX will have gone to countries on the African continent. So as of today, Simon, that stands at almost exactly 17 million doses, and it'll go to nearly to about 18, nearly 19 million doses by the end of this week. In terms of the bigger question you raised about the overall vaccine supply, this continues to be a real challenge. As most of the journalists on the call are aware, the demands of the escalating outbreak and pandemic in India have made tremendous demands on the supply out of India, the SII producer in particular, which is one of the main producers that supplies the COVAX facility. And we do know that India is working hard to ensure that as it meets the needs of its own citizens, it can also ensure that SII doses can continue to flow through COVAX as well. So there is certainly the commitment on that side to ensure that that happens. At the same time, we have supplies from Astra Zeneca directly through the COVAX facility, and over the last 2 weeks, we've seen a real scale up in the speed and rollout of those products. And now, if we were to look at the countries supplied from the Astra Zeneca side, that now is getting up in the double digits as well. So, Simon, one of the things we'll be looking at is how best then to distribute the doses that are coming out of SII, out of AZ, et cetera, to make sure that all countries, and especially and including the countries on the African continent, can be covered as well. But the reality is the whole vaccine supply situation remains precarious, and the challenge still, because of such competing demands for these doses, remains a very difficult one to manage. As the good news is, as we spoke about previously, that the interval between the AstraZeneca doses can be extended out to 12 weeks and probably, if necessary, a bit longer. So we do have a bit of time to the second question that you asked about ensuring people get their second doses. But obviously, we would like to make sure that that interval doesn't go longer than that. So we're doing everything possible to ensure the supply of doses of AstraZeneca product in particular, because that's what's gone out already through COVAX, but that continues.